Hi, I'm Dr. Arain, and today we're going to be talking about how to do a diabetic foot self-exam. So the first thing you want to do is actually look at your feet. You want to check and see if there's any cracks in the skin, and that would include at the bottom of the heels. And you also actually want to look between each toe and in the inner space and see if there's any cracks or peeling or flaking skin. And the reason why this is important is that it could indicate possibly an athlete's foot or some other issue that's going on. The second thing you want to do is you want to take a quick look at your nails. The nails should be straight across, and you also want to look at the nail bed and look at the nail folds. So if you see any swelling or redness or break in skin or drainage in that area, then that is a sign that you need to see a doctor. You need to come and see one of us. The third thing is that if you have any lumps and bumps on our feet, like many of us do, if it's over on this side by the big toe, it could be a bunion. If it's on the top of your toe, it could be a hammer toe. You want to check for areas of irritation or thickening skin or blister formation. If you do have redness or irritation, that could be a corn or a callus or a blister, and you shouldn't be taking care of that by yourself. Again, you should come and see a podiatrist. The number 4, what you could look at when you look at your shoes, look at your feet, it's also important to look at your socks and shoes. So a lot of times we wear socks, and if you see any drainage on your sock, then you know that there might be an open sore somewhere on there. Sometimes with diabetics, they have something called diabetic neuropathy where they can't feel everything, and you might have a cut or a sore and you don't know it's draining until you actually see your sock. And the last thing I'd like you to do every day is actually look at your shoes. So a lot of us have little kids, and there might be a little Lego that can be very dangerous if it gets stuck in there, or a puddle or anything like that. And with diabetic neuropathy, sometimes if you're standing on something for a long time, you won't be able to feel it. So something in your shoe that you're walking on for a couple hours a day can actually injure your foot. So these are just some tips that, as the doctors here at Prairie Path Foot and Ankle Clinic, would like you to keep in mind as a diabetic patient. It's very important to do these diabetic foot self-exam every day.